Todos Medical has announced that its Provista Diagnostics clinical laboratory is now offering saliva-only monkeypox testing. Joining us more is Todos CEO Gerald Commissiong. And Gerald, good to speak with you again.
Oh, thank you for having me. Great to speak with you.
So that was fast work. We spoke just a few days ago about this, and you're already moving forward with the saliva-only testing.
Yeah, no, we were quite fortunate. We had a lot of patients reach out to us. Some who'd had testing, who wanted to see if they still had, monkeypox. Some who had challenges getting monkeypox testing, especially among women. And so we were quickly able to get what we needed in order to complete that saliva-only validation. And now we're still going to focus on saliva and lesion for people that are symptomatic. But for people that are pre-symptomatic, we think that this test could be very important. If they test positive, they may be able to get access to TPOXX. We have seen that at this point, and so it's a very important test that we think we can get to the market and start to scale it.
Gerald, take us through the benefits of scaling up testing without waiting for the lesions to appear, because I assume you want to contain this as quickly as possible.
Yes, and one of the things that we don't know about containing it is when the infectious period starts. So we know once people develop lesions, those lesions become infectious, and you can give it to people. We don't know with the respiratory side of it exactly when you become infectious, and based upon what we know with COVID, we have a reasonable understanding of the CT values related to infectiousness for that disease. So within the context of pre-symptomatic testing, when you're testing someone who's been exposed and you don't know if they're infected, you would expect, somewhere between 5 and 15 days after that exposure, they could potentially turn positive. And if you can catch them at that early stage, which is especially important given the sensitivity of the test that we have been doing on saliva, we had several vendors to choose from in terms of access to the raw materials, and we chose a vendor with just exquisite sensitivity on the assay. And so we were able to pick up very, very small amounts of monkeypox virus, which we think is going to be very important in that pre-symptomatic stage, because it's very unclear, how quickly those viral loads go up. So we think, you may be able to test once or twice, a week after exposure, 2 weeks after exposure. And if you test negative both of those times, it's unlikely you're going to develop it. And if you do get it, it's possible, we need some more data, but it's possible that you may not actually be contagious from a respiratory standpoint, which would be ideal. So there's a lot still to do in terms of learning at a population level once we get a lot more testing, but at least early on, the data that we have is important and can make a big difference for a large group of these patients.
So take us through the procedure and also the turnaround time for the saliva testing, Gerald.
The procedure is quite simple. It's a open tube. There's no preservative in there, so it's basically a dry tube, plastic. You spit in that tube. Of course, we have other packaging that goes around it to prevent the tube itself from carrying infectious virus on it. So it gets packaged properly, sealed, and sent the same way COVID samples get sent to our lab. Usually, depending on which jurisdictions we're working with. So, for example, for COVID, when we ship, most of our clients are really in New Jersey. So when we ship from New Jersey, we use Delta Dash. So we have a service center here that collects. They arrange and package the samples, and then they get shipped either at 9 o'clock at night or at 6 a.m. Either way, they're at the lab anywhere between 7 a.m. and 10 a.m. They're accessioned before noon, and we typically report out before 5 o'clock. So this will effectively go in the same kind of workflow as our COVID. Because it's smaller volume, we don't expect thousands and thousands of samples initially, so you can get that run done within the same day. With COVID, sometimes if you get too many samples, you may have to give 48 hours as opposed to 24-hour turnaround or 36 hours, but we don't expect that, especially early on with monkeypox.
So the Provista saliva test is available in all states at the moment except for New York, but you do expect New York to follow shortly, is that right?
That's correct. Yeah. So we have license in California. We're authorized in every state. The only state where we're not authorized is New York, and we have our inspection on September 19th. So shortly after that, we expect that we should be able to offer this test. We can also take COVID from the same sample. So if it does ever happen, there's an outbreak in a school. In that setting, you could have kind of a dual screening protocol, which we think ultimately could be very valuable because we do think that there's going to be COVID problems also. So ultimately the saliva does seem to be something that is easy to use and really valuable because of it's very dynamic in terms of what you can do with it.
Okay, and I believe you're already reaching out to schools in the Atlanta, Georgia area, so you have started moving on this.
Correct, and we are partnering. We're in the process of putting partnership together, or a vendor agreement with a calling group to call around to all schools, and we have protocols that we're establishing. So I think right now most schools aren't really thinking about it per se, but they need to be made aware that testing is available because right now the narrative is really just a gay male problem. But we started to see news stories of kids getting infected and then other kids in the school now getting infected. We saw this in Georgia, not too far from us, actually, Newton. We reached out to them yesterday. So, when you already have community spread inside a school within the first week, it really does should raise the specter that, these things are going to get out there. And especially if it takes a 2 to 3 week incubation period and you don't know for a lot of that time that you are infectious, it's really a potential recipe for disaster. So we think that, when you find out that you have a case in a school, you should just test the school. And while you're at it, you can probably find a lot of COVID and you can mitigate the spread there as well.
Well, I hope you'll keep us posted on any progress, but thank you very much for the update today, Gerald.
Absolutely. Thank you.
Gerald Commissiong is the CEO at Todos Medical.